So we're going to move into the hamstrings. So I think it's very nice to do a little bit of exploring before you even undrape. And this allows me to introduce my touch to them, to kind of get a sense of the pressure, to feel anything that stands out to me, and just to warm them up a little bit. So, to undrape, we're going to hold the edge of the sheet, hold the edge all the way over, hold the heaviest part of the leg. I like to get low and stick it into my arm because this is a tree trunk, so I got the tree trunk, so I want to hold it well, and then come up to the diagonal. All hamstrings begin all the way up here at the ischial tuberosity. So we have biceps femoris, semitendinosus, and semimembranosus. Biceps femoris that comes down to the head of the fibula, and the semisisters that come down to the medial proximal tibia. If you lift the knee and you feel the tendons on the back of the knee, those are the tendons of your hamstrings. You'll feel one for biceps femoris on the lateral side, and you'll feel two for the semigirls on the medial side. Just a little fun information. So we want to start with the compression at the ischial tuberosity, where all of these muscles hang on nice and tight. We want to get a compression to loosen up their grip. So feel the ischial tuberosity with your elbow. Make sure your foot isn't past your work. And then we're going to start with the compression, and we're just going to sink straight down. Our intention here is to make space between the femur and the ischium. So once I get my pressure, I need to get my vector. So I shift my weight back slightly, keeping my pressure with a slight little vector. Especially when you're dealing with hairier legs, it is best to go with the fibers in which the hair runs, the direction in which the hair runs. So coming up without any oil will pull hair. So we're going to go down the whole entire time from origin to insertion. And I'm just working myself around the ischial tuberosity, kind of like I worked myself around the greater trochanter with my glutes. And again, coming up this high, it's going to feel very, very specific. And when you're confident with your work, it's not going to feel intrusive. It's going to feel very therapeutic, and they're going to want to come back for more of your massage because you're so specific on what their body needs, not just going through a recipe of a massage. Everything's relaxed, everything's relaxed. So once you do your compressions around the greater trochanter or the ischial tuberosity, you can do a series of compressions going down, and then you can end up with a stroke. Again, a series of compressions can make a stroke much easier. So we kind of want to be able to differentiate biceps femoris from the semigirls. And you usually can feel like a line in the center where they come together and they grab on tight. So a series of compressions right down to the center where these muscles are stuck together, it's nice to open them up so they can slide against each other. And sometimes that's just what I visualize as I move down with my series of compressions. And you can feel around where you should go. Hamstrings can be sensitive. So just like all compressions, you need to be welcomed in. You come in slow, get your depth, get your pressure first, and then get your vector, which is going to be towards his feet, my vector. Stretching the muscle. I almost imagine like I'm almost creating a new origin with my compression. I'm pinning the muscle down. I'm giving it just a little bit of my vector, just like a little bit of a micro stretch, just pulling that muscle in the direction I want it to go. Untangling that disorganized fascia. And you can, up to you. You can do lines of compressions, or you can move back and forth and just do series of compressions where you feel it needs your work. Depends on how lost you want to get into a hamstring and how much time you really have. You can spend a lot of time here if you wanted to. Oh, how's this spot? Was that a yes or no?
That's a good spot.
Good spot. So I asked him how this spot felt because I just felt like a little bit of a ball. So I'm going to try to soften that ball. And remember, the thicker the adhesion, the longer it took to get there. So we have to be the therapist who doesn't work with our ego and say we found something and we're going to dig it out until it's done, because we can cause more damage to the tissue. We make a difference every single time by slowly working that tangle out. Just like a tangle in your hair. Some of these tangles are almost dreaded, and we can't just brush the dread out. It takes a little bit of time. So sink, vector. And I can do lots of compressions. I'll let this be my last compression. We just don't want to compress into the back of the knee. The muscle spreads out here, and there isn't the hamstrings in the back of the knee, so you just don't go to the back of the knee. But I can work myself all the way down. I can work myself down this more lateral posterior edge. I can also do a stroke. So we're going to sink, shift our weight back, and begin to stroke down this muscle. You can see how if I was going up the leg, this stroke wouldn't be very comfortable. It would be pulling his hair. And it's not nice to get your little tiny hairs pulled. So it might not look like I'm moving a whole lot, but I'll put my finger here so you can see how I'm slowly pulling away from my finger, because the melting of their fascia isn't something that I can control. I can control it only by the amount of pressure that I put and go to its resistance. And then it slowly melts, and it feels like a wave underneath my hand that's pulling me along. If I force it, it's going to feel pulley and almost burny. So if they're getting that sensation to you, you're going too fast and you're forcing yourself through the fascia. So we don't control the speed, we manipulate the speed. So all my weight's been shifted to my front foot. I'm going to take a step forward, put my weight in my back foot so I can continue these strokes down, especially these long strokes. I like to put my hand behind my back because that helps me keep my Tai Chi trunk tucked and my shoulders back, and helps my head stay up. Sometimes I'll hold the side of the table, but you want to make sure that you're nice and tucked, and you're going to be in some positions for long periods of time, so you have to use your legs. It's where all the power comes from. So biceps femoris, we mentioned, comes to the head of the fibula. So I'm going to vector off to the lateral side a little bit, and I think sometimes it feels nice to change tools along the side of the knee to a smaller tool, and I can take myself down to my knee and I can continue that stroke all the way down until I feel the little ball of the head of the fibula underneath that knee joint. Feels a little bit more specific, a little nice. Most of us, what one word I like to use is yummy. This is a yummy spot. So, if I wanted to work the more semi-girls, I can come across the other side of the table. Sometimes I like to even pull them into me a little bit, and I can do that same stroke, but now I can get more onto that medial side. Sinking in, shifting my weight. I have a little bit more of a space here between my armpit because I'm having to go across the body, but that's okay. I'm still pushing off my back leg, and my foot is behind my work. And it's slow go. I'm trying to force it, and it's making it harder. So I'm going to close my eyes for a minute just to lean into it and not try to rush through, because I'm demoing, and listen to his fascia instead. There we go. Now we're moving. Doesn't look like we're moving, but we're moving. I'll keep my finger there again. You can see, even though on the surface it doesn't seem like a lot of movement, if I close my eyes underneath, it feels like a lot of movement, especially on these long strokes. A lot of times I like to close my eyes because if I see how further I have to go, sometimes I automatically try to force it and go faster. So if I close my eyes and I just feel the work, it allows me to slow down and get into the melting of their fascia versus me trying to control the speed because I have so far to go. And just be aware of your shifting of your weight. As you move down and your weight is shifted into your front foot, you can always take a step or skedaddle your back foot You just took a nice big breath, so I know we just got a good spot. So I can continue the stroke down, but I want to show you a compression. It's a little congested right here to me, so it's a good spot for a compression. So I like to kind of hold that spot with my thumb, just so I don't lose it. And I'm just going to come in, not with my elbow. We don't want to come in hot. That's how I can get more pressure. Forearm. Sink into it. And then shift the weight to your vector. Elijah, if you had to give us a number, what number would you give it?
Right now it feels like about 4.
Okay, so he says it feels like about a 4. So I'm going to show you how the pressure can go up just by moving the elbow. So I'm using a broader tool with my arm like this, but if I lift my arm up, has the pressure changed at all?
Mm-hmm.
What do you think we're at now?
About a 6.
Now we went from a 4 to a 6. So it didn't take any more effort on me pressure-wise. I just got more specific with my tool by just lifting up my arm. So easy. And I can hang out for as long as I need to hang out for this fascia to melt. Just keeping my vector. So this is how we can make our pressure feel like deep tissue. It's not that we have to work harder. It's just we have to work more specific. And when we get into the right spots, it feels like a lot of pressure because you're in the spot that needs the work. And then just like the other side, I can continue the stroke down into the knee. Am I pulling hair at all?
No.
Okay, let me know if I do. Sometimes I know it's hard to talk to clients when they're on the table, but I want them to feel comfortable, that they can tell me if anything is uncomfortable, because I want to fix it for them. I want them to know that this is their massage and I will adjust what needs to be adjusted. So if you're not sure, don't be afraid to ask. And I sometimes, when you ask, it makes them more comfortable to tell you if something is not feeling correct. And then now I'm going to go inside the knee, so I'm going to switch to a smaller tool. Supported thumbs, and I'm just going to take this down the side of the knee until I hit the bump of the tibia underneath that knee joint. And this is just being specific. Something I say a lot, a good massage therapist is a confident massage therapist who does things that not all other massage therapists will do and pays attention to detail. And deep tissue to me is really paying attention to detail. And I'm just going to go this little edge again. And that's a quick demo of the hamstrings. You can spend as long as time as you want there. Big, big muscles, strokes, compressions. Get lost. There's plenty of work to do. So now we're going to move on to the quadriceps. You're going to find the work is very similar to the hamstring, except for the quadriceps can be a little bit more sensitive. So just like the hamstrings, take a little time just to kind of feel yourself around. Maybe like a little mini palm compression. And just see what you feel. Test their sensitivity. Some people, very sensitive in the quadriceps. So, I'm draping. Hold the heaviest part of the leg, tuck their leg in, and then make a nice high drape. So, like the hamstrings go all the way up to the ischial tuberosity, rectus femoris. Elijah, will you tighten your quads for me? So this is his rectus femoris. Thank you. You can relax. This goes all the way up to the anterior inferior iliac spine. That's a little harder to feel because it's a small little knob, but I know where the as is, the anterior superior iliac spine is. So I'm going to start my compression just inferior to that. So if you feel your as is and you kind of sink down a little bit, there's like a little bit of a gully, and then you're gonna start your compression like right at the bottom of that little divot. So right about where I have all the sheet bulked up at. So let me unbulk the sheet so we can get a little bit better here. So here's his as is. Here's that little divot. And I'm gonna start my compression right about there. And here I'm trying to make space between the femur and the ilium. So I want to sink and then vector towards the femur, towards the foot. This can be a tickle spot on some people. So the nice rule of thumb with tickle spots is to go slow and deep. So I'm going to slowly sink in. 3. And then I'm going to make sure my pressure's still the same. I'm going to shift my weight back so I can shift my weight back into my front foot and get a vector. I like working at this height. A lot of times when I go get massage myself and people do my hamstrings, I ride my bike a lot and it feels like I have a big ball at the very top of my hamstrings, and nobody goes up this high to get it, and it doesn't feel complete to me. So don't be afraid to get up high even though we get close to private areas. Again, be confident and do good body work and think of the origin and the insertion of the muscles instead of where on the body specifically you're working. And you're going to become their therapist because you do things not all therapists will do. Now I'm just going to keep on working down with my compressions. Underneath rectus femoris, we have vastus intermedius. So it's going to be a little thicker. You can see how it gets a little thicker right near his tattoo. We have several muscles there. Especially if you start working on athletes and things like that, sometimes just after a workout, their quads can be very sensitive. So you only work up to their pressure level. When you start to feel how the tissue yields to your pressure, you don't always have to check in so much on what their pressure is, but I always make sure that they feel comfortable, they can tell me even if I don't check in. So please, if the pressure gets too much, let me know, okay?
Okay.
And again, I can do a whole series of compressions, the whole entire quadricep, just like we did on the hamstrings. It can take a long time. The quadriceps are our heaviest group of muscles in our whole entire body. There's plenty of work to do in a quadricep. It really just depends on how much work you want to do in a session and how long you want to how long you have to work in the session. So I'm just going to do a couple of these compressions just to, oh, it's getting a little sensitive. Is it okay? I feel it kind of ball up right here underneath my elbow. So I think the next spot we're going to get to is going to be, we'll see. I think it's going to be a good spot. So I want to make sure I kind of get it. Okay. How's this place right here?
About like a 6.
A 6. Okay, so that's my pressure, and now I'm going to get a vector. How's that?
Yeah, 7.
7. So sometimes it can be a lot in the vector, and as I vectored, I felt another little adhesion at the end of my vector. So it almost kind of tells me where to go next. So get lost. It's kind of hard to feel with your forearm the way we're used to feeling with our fingers. So it's like a whole new concept to use this like you would use these. So just do your best and start to feel where they need you. It feels more like a line of tension. So I can warm it up a little bit more with a palm stroke, and again, big tool, gonna not be as much pressure, it's gonna cover more surface. But as I go through here, I'm already speeding, let me slow down. As I move through here, I can tell I want to go into some thumbs because I feel it broad, but I feel within my palm a line of tension. So I'm going to switch to a thumb and get a little bit more specific. So it feels like a little tight piece of dried spaghetti noodle. And it's great when you have tattoos because I'm like, oh right, it's right next to the nose. It's in the mouth. It gives me a good guide of where to find things. Am I pulling hair at all?
Mm-hmm.
How's the pressure? Is it okay?
Yeah, it's pretty good.
What number do you say we're at?
I'll say 5.
5? My job isn't to work to a 7. My job is to melt fascia. But if I wanted to get more pressure, I just make sure my body mechanics are correct and maybe I slow down a little bit. And when you find a spot that is painful for somebody, doesn't mean don't touch it again. It means this is where you need to be working. You just maybe not need to work at that spot with as much pressure as you did. If it's uncomfortable for them. Just lighten up your pressure, but this is your body's way of saying someone's here to help me. I want to let them know this is where I need to be helped. And a lot of times I think we might shy away if we hurt somebody. Don't shy away, just approach it a little bit more gently with a little bit more love and compassion. How's that right there?
That's a good spot.
Okay. So I can add a little bit more pressure by going into a compression at that one spot. And then, how's that?
That's good. Like a 5.
When I was using my thumbs, was the pressure better?
This is better.
This is better, okay. This is more comfortable for me, so I'm glad it's better for him too, because I can hang out here longer with my forearm than my thumbs. Elijah can take a lot of pressure on his quadriceps. I don't get that on all people. So don't judge a book by its cover. Sometimes I work also on people who do, Elijah does a lot of weight training, but people who also do competition for weight training, so they're very developed and sculpted. And you would come, sometimes I've come to them going, oh, I can, like, look at all this muscle, I can do lots of pressure. So don't judge a book by its cover, because a lot of time the pressure on somebody like that might be even less, where you think they can take a lot because of how they look. Doesn't necessarily be the case, or vice versa. I have some older ladies who I work on who are in their 70s who want more and more pressure. So listen to the tissue. Let the tissue tell you how much pressure to apply. Let your client let you know what's enough and what's not enough. And again, if it's more pressure that they want, get more specific. Don't try to work harder. Get more specific of where to work, and it will feel like more pressure without much energy on your end. All quadriceps attach to the tibial tuberosity, which is the very top of the tibia. They go over the knee. So anytime the quads are tight, they can put pressure up on the knee and cause knee pain. So a lot of times when people come to me and they have knee issues, if it's not a tear in the ligament or the meniscus, it could just be from tight fascia of the quadriceps, which could lead to a tear in the meniscus or any of the ligaments. So just move yourself up. Proximal to the pain is usually where you'll find some adhesions causing pressure on the insertions or anywhere near that bottom part of the knee. And I don't want to apply the same pressure going over the knee, so just like before, I can use my fingers to anchor me down and then pull my palm up to my fingers. Still nice and relaxed. I'm not squeezing. I don't see all this, the veins in on my back of my hand, because it's just chilling out, just nice and relaxed. It's coming from here. Slowly moving down. Pulling here? Okay. So, the quadriceps we know, we just went over rectus femoris, and deep to that is vastus intermedius. We also have lateralis and medialis. So I can try to get lateral. I'll use my forearm, or I'll use my elbow to tuck into my hip so I can be close and get my pressure. Or I can scoot back far to use my body. Either way, sometimes depending on where I get set up, since I do outcalls, how much space I have tells me how I can work, but you have options of whichever works best for you. I'm a little too close with my foot. So we can work all the way down, vastus lateralis. And sometimes I'll do both. Sometimes I'll start up close, and then I'll take a step back and get my body behind my work even more. I'm going to take this all the way down just to the tattoo and imagine that I finished it all the way down the leg just for time. So I also want to show you vastus medialis. Actually, we're gonna keep going. It's getting bulky and it's sliding, and I can feel it kind of having my palms coming up to an area of what I would call congestion. So I just wanna kind of be a steamroller and flatten out this little road a little bit. And I'm just shifting off, pushing off my back foot, keeping my Tai Chi trunk tucked. And once all my weight shifted, I'm gonna skedaddle my foot up, get my weight back there so I can continue my stroke down. How's the pressure right about here? Is it okay there?
Yeah, it's pretty good.
Okay. What, give me a number?
2.5.
Okay. So it's kind of bulky there. If I can continue the stroke down, or again, I can get a little bit more specific and change my tools. How's the pressure now?
Pretty good.
Give me a number.
Still 5.
Okay. The pressure didn't change. I'm still melting fascia. I'm good at a 5. I just got a little bit more specific. And just like our hamstrings, I can take it down to the side of the knee, but I'm going to use a smaller tool. Sorry. I needed a little pat on my knee. And there is, taking it down to just below the knee joint. And again, like we did hamstrings, again, they're both very similar. If I wanted to do vastus medialis, I just come across the side of the body, same thing. Move myself on down. Sometimes I'll pull the quad into me and I'll support it with one hand so I can push with the other hand. The hardest part of the stroke is usually the beginning, because I want the stroke to begin. I want it to go, I see how far I have to go. So this is sometimes where I have to close my eyes and just lean into it and let the stroke pull me through without starting it. Because it's a patience thing, and sometimes I think I have it and I don't. So have patience with me by watching how slow I have to go. And I'm going to just put my finger again so you can see how I'm slowly pulling away. It just doesn't look like it, but underneath my hand there feels like a lot more pressure or a lot more movement. I'm going to try a different angle by switching hands. I'm not quite moving like I would like to, and I don't know if it's my impatience or it's the fascia that needs a little bit more warming and attention. So I'm also going to show you how to do compressions from across the body, because again, a series of compressions can sometimes make the stroke easier. So I'm going to do compression right about here. So using my lower hand coming across the body, you're going to press into the muscle. I got a little moan. I think that's good.
It's like a 7.
Like a 7. And I'm barely doing anything at all. So this is what the muscle needed, not so much the stroke. So I'm just going to hang out for a second at this pressure, and then I'm going to vector this way. How's that?
7.
Okay. So a series of compressions. If you're finding yourself either maybe being impatient or the fascia not responding the way you'd like it to, if your body mechanics there are in check, go to a series of compressions and then go back to the stroke and then see if it makes a difference. And sometimes just a series of compressions is plenty. There's lots of work again to do here, just like in the hamstrings. I can spend a whole entire session in quadriceps, especially if people have knee issues. And rectus femoris, by the way, since it goes all the way up to the inferior iliac spine, one of its jobs is to assist with flexion of the femur. So the word femur and the word hip go hand in hand when they're talking about it. So when people talk about their hip flexors, rectus femoris is one of the hip flexors. Not the main hip flexor, but a hip flexor. And if you're doing massage for any period of time, you're going to have people who talk to you about injuries or tightness in their hip flexors. So working quads will help with that. And then I'm going to come on out, and I'm going to continue down with a stroke. And just like the other side, I'm going to come down to the side of the knee, and now I'm going to be working when I get to the side of the knee on a smaller surface, so I will change to a smaller tool. Pressure okay? Is there pressure on your knee when I do this?
A little bit.
So check on that. Sometimes this can be too much for some people's knee. I can think of people in particular that this stroke down at the bottom wouldn't be comfortable for them. So check on the pressure on that medial side of the knee. A lot of times when people do have meniscus tears and things like that in the actual knee joint, it is on that medial part of the meniscus. And then we gotta go down to the ankle and all kinds of stuff, but we can talk about that later. And then we just change into our thumbs to continue out that stroke, to make it nice and massagey. And again, you can spend as much time on the quads as you like. There's plenty of work to be done. And then I think once I usually work the hamstrings and the quads, I think it's nice to give a little bit of traction to end my session. So I work with their breath. I make sure that their joints are aligned. The ankle is aligned with the knee, which is aligned with the hip. It's not off to the side. And then working with their breath as they exhale, I get low and I slowly just give them a nice little bit of traction. And I like to hold it for a good breath. This can give some people, me, myself, I can feel this in my lower back when it's tight. And then I like to make it just kind of feel complete. I'll end with a little bit of pulling on the toes. And then we redrape. And we finish our quadriceps.